Hello everyone, it's Nurse Nay. Today I wanted to just talk about a couple of things, which if you follow us on Instagram, you already know. There's a couple of acronyms that I wanted to share with you guys. So I'm going to wait for a minute or a little bit. I hope that you guys had a great week and that you're going to have a great weekend. It's Friday. I did just post a video, so that's up now. So one of the acronyms that I wanted to talk about involves how to give report to another nurse. So the acronym for that is CART, C-A-R-T. So it stands for changes, appointments, results, and task or time. So these are like really good topics that you want to talk about when you're giving report, and it's a really easy way to remember. So you want to talk about changes. What happened during your shift? Did somebody fall? Did somebody get a new medication? Was there some sort of incident that occurred? So that's important to talk about in your report. Something that needs to be passed on, something that might need to have a progress note written about, like if they're taking an antibiotic, usually you need to write a progress note on that like once a shift or so. And then appointments, that's really important if you're giving a report from night shift to day shift. They really need to know, like, this is from the long-term care setting perspective. They need to know if any of your patients have an appointment that they're going to be going to. That way they can make sure that they give their meds before they get picked up. Make sure that diabetics eat or have a snack brought with them. So that's really important to give during report as well. Results, to talk about lab results that may have happened, or results that you're waiting on. That's important as well. And then task or time, which is like, for instance, their last pain pill, when their IV is due, if they're getting catheterized, if they're getting straight cathed ever so often, they need to know what time to do that. If you're checking for urine output, say you removed a Foley cath and they need to check their residual with the bladder scanner, they would have to do that within so many hours. That's something you would want to put in report as well. So CART, changes, appointments, results, tasks, and time. And like I said, if you follow us on Instagram, you already heard that, because every day I do a story. So this coming week, we're going to talk about courage on Monday as like a word for the week to think about. And then Tuesday I'm going to talk about how to talk to family. Wednesday I give you guys like a little story. I'm going to talk about a patient that I had named Ella. And then Thursday is when I do a sample progress note. So it's going to be an admission note. And Friday I talk a little bit about self-care. So yeah, join us on Instagram for that. And then another acronym that I wanted to give out is PACED, P-A-C-E-D, and that is for talking to family. So what that stands for is prepare, answer questions, be confident, listen for like what the effect is, and then document. So if you know you need to call the family for something, say you had a fall, they're going to be like, why did they fall? So prepare so that you know how to answer that question. And then when they do ask that question, you have somewhat of an answer. Like they were trying to get up on their own, they were trying to go to the bathroom on their own, they didn't have socks, non-skid socks on, and they slipped. They didn't lock their wheelchair when they tried to get up, things like that. And then you need to sound confident. If you are like, well, I'm not really sure why they fell, you need to sound confident and know what you're saying, and the conversation will go a lot better. And then listen to them, listen for the effect that your conversation is having. Do they understand what you're talking about? Are they confused? So your goal is for them to understand what you're discussing, of course. And then the last letter D is for document. So you always want to document that you spoke with the family. You're going to document that you spoke with the family and that they understood. So when you write your progress note, you would say, so-and-so notified of patient's fall, voiced understanding, no questions at this time, voiced understanding. That's pretty much it. So when you're talking about effect, that part in your nursing note can just say voiced understanding, and that's how you document that they understood what you're saying, obviously. Yeah, so those are just a couple of the acronyms I wanted to throw out for you guys. CART for giving report to the oncoming nurse, and then PACE for talking to family members. Most everyone knows the SBAR, which is taught in nursing school, situation, background, assessment, recommendation for when you're talking to a doctor. But yeah, so I hope this helps you guys. I just wanted to pop on here really quick. I haven't been on for a while, and hope you guys can watch the video that just posted. And yeah, make sure to follow us on Instagram because I do stories every single day pretty much, except for Saturday and Sunday. Sometimes I don't, but I hope to see you guys over there on the gram, and I hope you guys have a wonderful weekend, and I will talk to you later. Bye.